And one of them is e-health readiness assessment, focusing a lot on telemedicine, of course, because that is sort of the speciality of this project, since we believe it's a good carbon reduction strategy for the health sector. So you have to keep in mind that these results are not totally finished yet, but I think it can be quite exciting anyway. So the aim of the inventory is to look at the technological requirements for different services as a first step, and then look at what kind of infrastructure that is available in both Sweden and Indonesia. So this is one of the assessments that are focusing on both countries. And you may laugh, but I have written that access to reliable technical infrastructure is just as critical to the success of e-health as air is essential for our existence, because it's totally fundamental for using these services as a reliable infrastructure. And I think that you already know, all of you, what e-health is, but it's the transfer of health resources by electronic means or providing care. And the examples that we are focusing on, it's not covering the whole field of e-health, but it's both addressing electronic health records, telemedicine, and different types of transfer or storage of information, health information in digital format. And yeah, as you see down here, particular emphasis on telemedicine, since this is a great potential for health sector mitigation and adaptation. So the first step of this assessment is to look at what kind of requirements that we have. And of course, the first thing you need is a computer. If you don't have a computer, you couldn't do anything of the rest. If you want to be able to store information and access it from many different places, you also need some kind of local area network or service and connection between the different computers that are going to access this information. And if you want to transfer it between healthcare providers or to the patient's home, you also need access to the internet. And we have tried to group the different types of services a little bit according to complexity. So up here you have the type of electronic documentation that doesn't really need a remote connection if you just want to document in electronic format. But of course, as I've written in the comments here, that online records that many people can access is of course going to improve the potential of other people accessing the information and adding information to this system. Next part, increasing in complexity, is like telemonitoring or consultations that does not require a real-time application or real-time contact. So I've written store forward transfer information. This could be very simple data like vital parameters or blood pressure measurements or similar things like that. It could also be like sound, ECG, or images. So, for example, teleradiology is maybe the best known example of this kind of application. And they are, of course, going to require remote connection. They don't require audio-video in this case. Some of them even need a very low bandwidth and doesn't really care about signal latency. This is the delay that you can have in information transfer. And we have defined now at this stage that low, medium, and high bandwidth are 128 to 512 kilobits per second. It's the low range. 512 kilobits to 2 megabits per second is sort of defined as the medium range, and 2 to 20 or even higher is considered as, oh, it should actually be 4 here. No, 2. This might change, but this is just sort of to give you an idea of what kind of range that is needed for the different applications. The next in complexity is what I have called a virtual visit, which means that you have also audio-video requirements that you can communicate with a healthcare provider or with a patient in the patient's home. And then means that we have a requirement of a higher bandwidth and also a low latency, because meeting at a distance and you have like a high latency in the system means that you always have to wait for the reply. You typically have not a very nice meeting experience. Good to mention here also, because I think we'll come back a little bit to that this type also needs data in digital format. You typically need other types of equipment to do this. And the last one, the highest in complexity, is if you're actually going to control something on the other side. Like we have a very good example from the project. Some of you have heard about this, the Cardista concept, where we control an ultrasound probe from a distance. But that requires both a very high bandwidth, a very low latency, because otherwise you would actually be able to hurt the patient if there's a delay in the signal. And the different types of communication, information communication technology, have different advantages. And I have just grouped them according to the fixed wire technology, for example, fiber network, broadband network. The mobile technology, which covers 2, 3, 4G, and also the satellite-based communication. And of course, the fixed wire technology is going to have the highest capacity. We have high bandwidth, we have negligible delays, but the disadvantages is that we have still very low penetration in developing countries, and also in regions where it's a challenge to introduce this type of systems. Mountainous regions, between islands, and you have both in Indonesia. And we don't know, but it can be sensitive to weather and climate extremes. If we have earthquakes, things like this. And of course, it's going to be a fixed location, so you need to be in a house or in the hospital to use this kind of system. The mobile technology is more mobile, of course, which means that we could bring it out in the field. We have, of 2G, we have a very good penetration globally. I think that we covers like 90-something percent, 97, 99% of the population, global population with 2G today. But it's also limiting for these kind of telemedicine applications. We have a relatively high penetration in the geographically challenging regions, because you don't have to have a fixed line between two places. So it's enough to put up two what do you call them, masts, communication towers. And it's particularly suitable for mobile offline data gathering. That is not the real-time meeting, but that you can gather the information. You can bring your computer or your if you have a mobile phone, something that you can enter the information into the system, and it can be transferred depending on then if you have 2, 3, or 4G. But of course, if we look at the disadvantages, we have a lower bandwidth, we have a lower penetration of 3 and 4G, which is required for these more advanced applications. It's less suitable for the real time, and the devices are, at least as they look today, sensitive to moisture and other extreme conditions. If it's very, very hot, very humid, these devices have not been developed. What is accessible today have not been developed for this kind of use that we would need, for example, in a disaster situation, if we want to be able to use it for communicating medical data. But I think that this is going to change, and especially if healthcare really want to use this, we are going to see a growth of companies developing this kind of tablet computers, mobile phones that are more robust. So this is something I think we can affect. And finally, the satellite-based communication we heard a little bit about yesterday, which is, of course, very good because we have a global coverage. It depends, of course, on the satellite position, but basically we can send and transmit and receive data anywhere on the globe. But we have a significant signal latency since, they are up high, and it's very, very expensive. And also it's sensitive to moisture and precipitation, so you are going to have a very much poorer signal in this situation where heavy rains, or in places where you have a lot of clouds and fog and so forth. But I think basically it's the cost that I didn't even put on the disadvantages, but I should have. And these were the kind of things that we were considering when we started to plan this project. But what has come up since I came to Indonesia and discussing with people like Lutfan and Google over there, hello, you have shown me that there are so many additional challenges than the existence of this kind of infrastructure, because in places you don't even have a reliable electricity supply, which means that you're not going to rely only on electronic documentation, because what happens if a patient comes in or you need to reach the information and you don't have electricity at that point? So that is something that we really need to discuss and address. And also the data in the digital format, because whether you have a very good Wi-Fi or even a solid fixed broadband line with high capacity, if you don't have any data in digital format, you can't send them anyway. And it's going to be very costly to replace all the X-ray equipment, ECG equipment, all the microscopes, so forth, stethoscopes, with equipment that allows the information to be transferred. So I think this is something that is very important also to stress, and to keep developing the kind of technology that they do here to allow digitalization of this kind of information. So then to the preliminary results on the Swedish side. I have simply just disregarded the computer access, because this is just no issue in Sweden. We have probably more computers than healthcare personnel. I wouldn't be surprised. So I'm going to try to find for the final report some data on this, but I haven't focused on it so far. But I have looked into the national health care IT infrastructure, the video infrastructure, broadband availability, both in healthcare and like in the private sector. Also the mobile network providers, and also briefly I'm going to show the e-health readiness profile that has been provided by the European Union. And just not to be logical, I'm going to start with the last point, because I want you to see, it's a rather poor image. But I want you to see that Sweden are very well ahead also by European standards. So this blue line is, I think, the average European situation in terms of broadband capacity. We have like e-prescribing, telemonitoring, exchange of radiology reports, and so forth. So we already know we have a very good situation in Sweden. And also in terms of the national IT services, Ronnie has already mentioned a little bit about this. Many of the services or platforms are provided by Inera and a company called Compodium, who is providing the travel-free meeting solutions. And for a little bit more than 10 years, all the Swedish healthcare facilities have been connected with this network called SjuNet, probably because SJ is the first two words in sjukhus. So the SjuNet is connecting all the facilities, and it has a very high availability. It's a prioritized network, up to 1,000 megabits per second. But of course depends on what the facility has a need for, and there's also coming cost with this. But what I think is the main message of this is that this is something that has been driven by the healthcare sector itself. This is not something that just someone has given to them, that healthcare has been very much a part of driving this development. And I think that is very important. And also, of course, that you see the Compodium, for example, that they have also engaged the private sector companies to be able to provide this for the health sector. The other very important platform that is important for telemedicine in particular is the video meetings that Ronnie also mentioned. So that is not only for Västerbotten, even though the picture is from Västerbotten. So we have this, I don't know the name in English, this brygga, so that you can connect many people. And if you apply for this in advance, you can have many people connecting with a very high capacity for multiple video meetings. And we also have a common national numbering plan, which means that I can go to a video conference room in Västerbotten and I can connect to any video conference room in the whole Sweden. It's part of any primary health center, community health center, or hospital.